Good afternoon, Miss Araba. Kindly introduce yourself to us.
Thank you so much for the opportunity. Yes, my name is Rita Araba Ishen. A registered nurse and is from the University of Ghana. Currently, I'm with Imperial Nursing and Home Care Services. I'm acting as the assistant nurse manager and also a nurse tutor at Oak City International College. So at the moment, this is what I do, and then this is a brief introduction to me. I'm particularly interested in adult health and especially the aged care. So when I heard of today's discussion, I couldn't turn it down. So I'm glad to be here. Thank you.
Thank you. Okay, so
Yeah.
today's discussion is going to be on diabetes mellitus. But before that, I'm Mariam Irama Williams. I'm going to be your host for today's health discussion. So, Ms. Araba, when we say diabetes mellitus, in general, what is it?
When we say diabetes mellitus, we're just talking about blood sugar levels being persistently high. So when you check your blood glucose level, and then it's persistently high. So not one occasion, not on two, but on different occasion persistently, then we see one has diabetes mellitus.
Okay. Um, so are there any types of diabetes mellitus?
Yes, so there are types. Um, we have two, and there are other types under the two types. So we have the diabetes type 1, and then we have the diabetes type 2. So under the type 1, we are looking at autoimmune disease. So when it comes to diabetes, we're just talking about insulin dysregulation body. So we are looking at the ability of the body to produce insulin to be able to take care of the glucose that we take in. So with the type 1, our body fails to produce the insulin. And this as a result of the body cells fighting against um the Langerhans. Yes. So the pancreas, the cells in the pancreas that produces the insulin, the beta cells. So if the body's immune system is fighting against the cells that will allow the body to produce insulin, then we'll classify that type of insulin, sorry, that type of diabetes as type 1 diabetes.
Okay.
Or type 2, which is the body's inability to produce enough of the insulin for the glucose that we're taking in to regulate it. Or the insulin is produced all right, but the body becomes resistant or becomes insensitive to this insulin that is in the body. So it leaves the body or it leaves the glucose that we have in our blood stay in. So when you check the glucose level, you see that it's elevated. So this is
Okay.
a type 1 and this is
Okay. So based on what you've been saying, you're saying that we have basically two main types of the diabetes mellitus. That's the type 1 and the
yes.
type
And
2.
we also have the gestational diabetes, which is
Okay.
being diagnosed with pregnancy. You know, when someone is pregnant, there is this high surge of hormones, which makes the insulin in the body very insensitive.
Okay.
So, period, yes, we also have people having diabetes, and we call that the gestational diabetes. So at least this makes it three types, of which we have other types under each of the main type, the type 1 and the type 2.
Okay. So before we can say that someone has diabetes, or if you keep checking your blood glucose, and before you can say that it is persistently high, it means that there should be a standardized range for either being a fasting or the random blood sugar. So, what is the specific range for the FBS, that's the fasting blood sugar, and the random blood sugar that should alarm someone that there's something ongoing in my system?
So yeah, as you mentioned, so sugar, which is usually taken early mornings, and we encourage the client who is coming to take this test not to have anything by mouth, especially food. over the last period of 6 to 8 hours. So we usually take it in the morning, and then the value should be between 3.5 to 5.5. But where I am currently, we say it should be between 4 to 6, so we don't have to um we don't want to deal with the points. So if you're checking for someone, then all the values you're getting should be between 4 to 6. But other research states 3.5 to 5.5 for
So
the
that's with the
fasting blood.
fasting. Okay,
Yeah.
okay.
So yeah, so someone to say that, okay, so they say I should go and then take the FBS, which is the fasting blood sugar, and I haven't eaten, and it's past 12 or it's getting to noon time. Can I still go ahead and take it? The body stores glucose. So when you are down of the glucose, the body breaks down the stored glucose, which is the glucagon, and produces glucose for the body. So this may distort your readings. So early morning before 11 a.m. is the best time to take our FBS readings to give us the accurate measurements. Yeah, so with the random blood sugar, we are saying 2 hours after feeding or after taking any meal. It could be your afternoon meal or it could be your evening meal. So, or even morning meal. And then we are looking at values about 5.5 to 7.8. That's what research says. I'm saying at my end, don't want to deal with the population. So we look around above 6 and then below 7. So between 6 and then 8 millimole per deciliter.
Okay, okay, okay. Thank you. So, with the diabetes mellitus we have been talking about this afternoon, is there any cause or are there risk factors to diabetes mellitus?
Yes. So depending on the types, then we can look at the cause or the risk factors. So when we look at the type 1, we are saying it's autoimmune disease. And these autoimmune diseases are generally through genetics. So one may inherit a gene that will predispose the person to developing the type 1, especially a gene or a gene defect from the mother or the father for the type 1. But for the type 2, we're looking at, it's also hereditary, especially with family history. If you are from a family where obesity is common or everybody has a tendency of becoming big, then we may say that, okay, you are at risk. I wouldn't say you can, or I wouldn't be, you are prone to getting, but we say it puts you at risk of developing diabetes. We also look at sedentary lifestyle. We also look at even our lifestyle, so the smoking, the alcohol intake, and then eating late into the night. So at times we look at the work that we do, and then looking at the time that we close from work, we are prone to eating late at night, and it's one of the things that may enable us or put us at risk of developing diabetes, especially with the type 2. Also look at exercising, taking strolls or walking. And so if you're not exercising and then you're living a sedentary lifestyle, it really puts you at risk of developing diabetes.
Okay, okay, okay. So there are several myths that are surrounding diabetes mellitus. Okay. And before I come in with what I have, do you know of any myths that are on the streets or are out there about diabetes mellitus?
Do I? Yes, I do.
Okay.
So people say diabetes, especially when we're kids, when we tell our mommies that, oh, mommy, please, we want to take in ice cream, we want to buy toffee for us. They say, oh, you get she will just say, well, is it tree? Is it
Uh-huh.
tree? Yes. So yes, my mommy or even as I then knew that if I take in lots of sugar, it will put me at risk of developing diabetes. And then I've heard a lot from even our clients when they come and then you want to assess them, they say a lot of these things that, oh, I feel like it's the sugar I've been eating, so now I'm not putting sugar in my meals. And I mean, it's not a myth, especially with them, that it is conk or it's been diagnosed that they have diabetes. But the fact that they want to associate it all to the fact that they are taking too much sugar or the fact that they are removing sugar from their diet, they should not develop diabetes. I
Okay.
think it's a
The ones I have here, so that we
okay.
can refute some of these myths, because I feel that um, this information being out there in the public, it's demeaning the actual facts about diabetes mellitus. So I want us to refute some of these myths or claims. Okay. So the first one is that diabetes mellitus is caused by eating too much sugar, as you are saying, taking the ice cream and the rest. It's out there that when you take too much sugar, you are going to get diabetes. So what do you have to say about that?
Okay,
And what is
so
the linkage to diabetes?
I mean, who am I to say it's not true? Maria, who am I? But looking at development of it, do you get it? So we are saying that if the body is not producing enough insulin, then all the foods that we eat, which have their byproducts as glucose, will leave us having higher levels of glucose in our blood. So it's not only about the sugary thing that we are eating, but it's the produce insulin or enough of it for us to be able to utilize the glucose that we are taking in. And
Okay.
it's not only things that we take in that release or produces glucose. The normal carbs that we are eating, the byproduct of it is glucose. So if you are eating our plantain, if you are eating our cassava, we are eating our tubers, we are eating our gari, our rice, we should be rest assured that we are producing our body. And if we do not have enough insulin in the body to help us utilize this glucose, of course, we'll get diabetes, and not necessarily the intake of too much sugar or any other thing that they say. And then
Okay.
let me add that, so if you're even consuming too much of sugar, as they say, and then the body is able to produce enough insulin for you to regulate it, you will not be prone to getting diabetes. Yes.
Okay. 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 There's another one that once you've been diagnosed with diabetes, it's not safe to exercise. I mean, with the treatment modalities, we usually advocate those that have it to exercise in addition to their diet and the other treatment modalities that there is. People say that it is not safe for you to exercise when you have diabetes. How true is that?
You. Why no complications of diabetes has a lot of body, especially the heart. And when we are exercising, we are putting more strain on the heart. So I'm trying to defend them. Maybe they are taking it from that angle
Okay.
that the diabetes or the diabetic patient's condition is complicated to the point that it has affected the person's blood regulation or even the cardiac activities that will put the person at risk of some of the exercises, not all of it.
Okay.
That may say that if you exercise, it puts you at risk of developing CVA. Some people used to stroke, you fall down, you have heart failure, and then die, and all of that. But there's not with all the diabetes.
Okay.
So as I if you're not exercising, it puts you at risk of developing diabetes. And then with the treatment regimen, exercise is packed.
Okay.
Is especially with the pre-diabetes. So I was recently having a course on diabetes that says that so far as you've been diagnosed with diabetes doesn't mean that you have the condition forever. So
Okay.
when you follow the treatment regimen, you'll be able to move or you'll be able to have a change in some of the medication or how the treatment modality is going. So
Okay.
with exercise, when you have diabetes, is one way or one sure way of helping you to manage the condition better. But
Okay.
nonetheless, if you have complications with diabetes, then you may want to consult your doctor to know the type of exercise that will be good for you, especially aged people, because it's like their diabetes wasn't diagnosed early. So some of them have complications of it, like the blindness. I mean, we get there. But when you have complications with the diabetes, that's the point that is affecting your heart activity, then of course some of the exercise may be minimized, but not entirely removed from your regimen or treatment regimen.
Okay.
Please, is that
Sure. And I think to add to what you just said,
okay?
when you exercise, okay, when you are diabetic and you exercise, it makes the insulin more sensitive to
Yes,
the
also too.
cells. So I think we have to look into that. Please dispel or debunk any information that is out there that when you have diabetes, you're not supposed to exercise. It's actually part of the treatment regimen. Okay. So when we say there's something out there called the pre-diabetes, I think you even mentioned it during your explanation. What is that? What is pre-diabetes?
Okay. So the pre-diabetes is a stage between having normal glucose blood glucose level and then being diabetic. So if you're having your values, which is between 5.5 to 7.5
Okay.
for your FDS, which is not necessarily higher to put you into the bracket for diabetes, then we are saying you're at a stage where if you don't take care, you can go away this way or that way, being normal glucose level or being diabetic.
Okay. So what are some of the symptoms that someone is going to experience if the person has diabetes? So we are looking at diabetic patients. What are some of the symptoms they usually experience?
Sure. So with the symptoms, I'm saying that we have polyuria and polydipsia. So the client or the person experiencing diabetes may have frequent intake of fluid. So there is this urge to take in more fluid. And then also there's this urge to urinate. So the more they take in the fluid, the more they
Sure.
frequently use the water. And with my clients, some of the nurses, when you put them in charge of a client, they complain that, oh, this client is not sleeping at night because of this frequent urination. But I feel like if you also understand that they have diabetes, it's one of the symptoms that you'll be able to know that it comes with it. And there's also frequent hunger. So they tend to take in a lot of food. Yes. So they are always trying to consume food, trying to take meals, and they are never satisfied. They are always asking for meals. And then there's also frequent skin rashes. So they develop lots of skin irritations and skin rashes around their body. And there's also increased they are easily fatigued or they are easily tired. So every small thing they want to take a rest. If I even exercise, they say, "Oh no, today I feel tired and I want to rest." And today I feel like I don't want to exercise and all of that. So I mean, these are some of the symptoms that comes with diabetes. Tingling sensation in the hands and then in the arms as well.
Okay. Okay. So, what are the diagnoses of diabetes mellitus, or how do we go about diagnosing diabetes?
Okay, so when it comes to diagnosis of diabetes, I think the earliest or the very first ones we do is the simple RBS and then the FBS checking that we do variously on the ward at the OPD levels. When you go there, they use the glucose and the test strips to check your blood glucose level. So whether RBS or
The
FBS. So
FPS.
depending on the from there, then they further because they cannot use those values to say or emphatically diagnose.
What is the treatment regimen for diabetes mellitus?
With the type 1, we are looking at giving the client insulin. So we put them on the sliding scale. So depending on the amount of insulin that is glucose that's in the body, we give them an adequate amount of insulin to regulate it for them. We also have the type 2 where we give them medications that will enable them sensitize the insulin
So,
to
yeah.
the glucose that is able to regulate the blood glucose levels. We also put them on exercises. Them have their insulin sensitized. Yeah, so we are looking at insulin sensitization. So the exercise regimen, which at this juncture to early people I will ask that they really consult their doctors on the type of exercise they can engage themselves in. And then also we also have the diet plan
Yeah.
where we restrict the type of diet they should take. So we were saying earlier that when it comes to the diet that we put the diabetic clients on, is a diet that every normal person should be following to be able to not consume too much of carbs into our body to now have the condition and then go through all this process.
And I also think actually there's a myth around that with the diabetes, diabetic patients in terms of their diet. I think some people think that when you are diagnosed with diabetes, you eat differently from someone who doesn't have it. And I'm glad that you've actually corrected or you've made that clear that we are supposed to eat a balanced diet, but then it should be in the right proportion. So you don't eat differently from someone who doesn't have diabetes. Yeah. Thank you for clarifying that for us. Okay. So do you have anything else to say concerning the treatment? Is there anything else to add so that we can move on to the complications of diabetes?
Yes. So with the treatment, of course, I cannot leave out the early diagnosis of it. Do you get it? So able to treat it, it means you also have to be aware that you have the condition. And usually people will wait. People will want to have source that is never healing. People will want to, go through all these complications before they even first go to the facility to have their glucose level check or have a checkup done. So I think as part now people are being sensitized on having their blood pressure checked. So I think it should also be part of our regular do to have our blood glucose checked,
Glucose.
if not every month, at least every to know what's happening with us.
Okay. So now let's zoom into the complications. If someone diagnosed with diabetes or a diabetic patient doesn't keep their glucose in check, what are some of the complications this person is likely to have?
So many complications that at times it's overwhelming. Look at my clients. I can close my eyes and just pinpoint to be like, oh, this person is experiencing this, so it's part. Yes, we have lots of complications that diabetes can bring. We are not leaving our hearts. All the organs will be affected if you have your blood glucose not regulated, and especially when you've been diagnosed of diabetes and then you are not taking your medication or your insulin levels religiously. So first, I want to talk about the heart. So the heart has vessels that all these bubble inside, making the blood vessels very weak and all of that. So of course it poses lots of risk to our heart, giving us it can even give us stroke, heart attacks, our coronary arteries can become very weak. And then when it comes to the eyes, one thing that it's really that is retinopathy. Yes, it can cause blindness to
Okay.
the point that client is blind as a result of
Wow.
diabetes, and then it can also, yes, it can also lead to amputations. Of course, as student nurses, when you go to the surgical wards, we are always seeing some people have their legs amputated. Yes, because of this slow healing that diabetes comes with. So at times it may lead to amputations. We also have kidney failure. Diabetes can cause your kidneys to shut down, can cause to have kidney disease and be put on dialysis without having done anything aside not regulating your blood glucose levels. We also have the erectile dysfunctions. We have skin infections or skin rashes that you may not, it cannot be explained that can happen with you. We also have I mean, this and many more. And all the organs in the body will be affected if you do not have your blood glucose level regulated or do not follow the regimen that has been given to you, especially when you've been diagnosed of diabetes.
Okay, okay. I think we've heard a lot about diabetes mellitus. So to conclude this discussion, one may ask, if you are diagnosed with diabetes, is a normal life possible?
Medication. So you don't have to feel that now I have to be left out. You have to embrace it. You don't have to stay out of school because you've been diagnosed of diabetes. It's chronic. It can be managed. So you take whatever that, I mean, the treatment regimen, if you are on insulin, if you are on medication, you just take it. And I mean, we all have that says hi to us. So of course, we can live our normal lives even after being diagnosed of
Okay,
diabetes.
okay. And I think it gets better with time. I mean, you just have to adhere to the treatment regimen, and in no time, if your sugar levels are regulated, I mean, some of the restrictions will be less. So yeah, it gets better with time. So being diagnosed with diabetes isn't the end
Yeah.
of the world. Okay, thank you so much for honoring our invitation, Miss Araba. So it is a bye-bye for now. All
So
right,
bye.
all right, bye. So thank you for joining us with this exciting health discussion. My name is Mariam Irama Williams. See you in our next video. Bye-bye.